I believe we can lead a revolution in mental health treatment in Britain.
We've increased by 5 times the number of people getting treatment for depression and anxiety.
A record level of investment in mental health.
They're promises that have come thick and fast. What's slower is any sign of the money getting through. When Ollie, who's bipolar, found himself in crisis, there was no bed available, so he was left overnight in a police cell.
The fear that I felt was just unbearable, so I just started punching the wall and I split all my knuckles and I was literally writing help in blood because no one would come and help me.
We got in touch with all 58 mental health trusts in England. 32 replied. Of those, 60% said they had cut the number of beds, leading to a total loss of 230 beds this year from those trusts that responded. Yet they reported spending an average of £29 million on private beds when their own were full, sending patients up to 328 miles for treatment.
She was so happy there, wasn't she?
Stephen and Julia Hollings face a 5-hour drive to see their daughter, who's being treated in an eating disorder unit in Glasgow after a month-long search for a bed.
No beds, and it kept on coming out. And then eventually this one came as a potential to be available in Scotland. We would take anything, anywhere, because you do.
The former Deputy Prime Minister, whose party pushed hard to get mental health on the same footing as physical care, says it's a betrayal of the most vulnerable.
Well, I haven't, as it happens, spoken out much before because I kind of accept you can't turn around a great tanker quickly. I know that as much as anybody else. But we're now a year and a half into a new government since the last general election, and not only is no progress being made, we're actually going backwards.
Hospitals are having to deal with all but impossible choices. With the NHS struggling to reduce its spiralling deficit, it's estimated 4 out of 10 mental health trusts had their budgets cut last year.
We all know actually that the NHS is in there's a series of fires going on elsewhere, and sometimes if you don't have a ring-fenced pot of money, it's pretty easy and tempting to use that money as a means to dampen the fire over there. But actually that shouldn't be the case.
The government has admitted emergency mental health care is inadequate and has a 5-year plan to put it right. But that's time those in need of help now simply don't have.